pap smear, or the Papa Nicolau smear, is a test that is used to screen for cervical cancer. So cervical cancer is very common, so that's why the pap smear is so important to us. It's actually the most common gynecological cancer in Jamaica. So one of the most common cancers affecting our women here in Jamaica is, and other developing countries as well, is cervical cancer. And the important thing about cervical cancer to note is that it's preventable. So it can be prevented. A lot of times persons hear cancer and you think it's something you can do nothing about, it's something life will just throw at you. But the thing with cervical cancer, it takes a period of years to develop. So it starts from an infection with HPV, and this can progress over 10, 20, even 30 years as precancerous stages, which can progress to cancer. So with the pap smear, what we're aiming to do is pick up on these abnormal cells which are infected with HPV before cancer develops, and thereby we can treat these abnormal areas and prevent cancer from forming. And that's why it's so important to screen, because this is one of the few cancers that gives us this opportunity to prevent the development of cancer. Persons may debate this because pain is subjective. So what may be painful to one person, somebody else might disagree, and pain thresholds are varying. However, the pap smear itself should not be painful. It may be uncomfortable, it may be a bit invasive because we have to put an instrument inside the vagina to access the cervix, but there are ways of making it a lot less uncomfortable. So smaller instruments can be used, lubricating the instrument well and using like warm gel, or ensuring that instruments are not cold. These are little things that can help to reduce the discomfort. Some persons may think it's something you do once every 10 years, or you do it once and you're okay, or normally you don't need to do it again. However, this is something that has to be done frequently to ensure that we're not missing any cancerous stages. So the recommendation is that pap smear should be done every 3 years. There are some persons who want to get the pap smear done every year because they might do it on their birthday or a special time of year where they get all the health checks done, and that is perfectly okay, that's absolutely fine. However, the guidelines recommend not going beyond 3 years. And let you know if you have the high risk or cancer causing HPV present. Now, when you combine this test, the HPV test, with the pap smear, it can increase how accurate you are in ensuring that there are no abnormal cells. And we encourage women over 30, once they're going for the pap smears, they can inquire about an HPV test in addition to the pap smear to increase the detection of abnormal cells. Since pap smears have been introduced, especially in developed countries where they have national screening programs where almost all women are screened, they have noticed a dramatic reduction in the incidence of cervical cancer in these countries. So for example, in the United States, since they implemented a widespread pap smear program, they have seen a 60% reduction in the deaths and the incidence of cervical cancer. So here in Jamaica, we're hoping to achieve that, and we encourage everyone to get screened and prevent this preventable